Here from Vet Triage. It is Monday, February 10th, 2025, 10:42 a.m. Pacific Time. We are going through this issue of Veterinary Surgery. This is from April 2022, and we're going to be talking about surgical sterility today. Boom. The comparative antimicrobial efficacy of 4 surgical hand preparation procedures prior to application of an alcohol-based hand rub in veterinary students. This comes out of the university in Pretoria, was in South Africa. The objective: to determine the influence of skin preparations before application of an alcohol-based hand rub on bacterial counts before and after elective surgery. This is a clinical prospective study with 103 veterinary students performing 140 ovarial hysterectomies, which are spays. In the picture below, you can see there in that video that she's scrubbing her hands, and if you notice, there's no handles to the faucet. So usually there's some kind of either a laser that triggers the water to come out of the faucet, or there are paddles down below by her feet or by her knees that she can push on or step on that turns the water on and off. And that way you can scrub without having to touch the faucet. The participants were randomly assigned to one initial surgical preparation on the day of surgery. Group A was hand preparation with medicated solution of 4% chlorhexidine, followed by the alcohol rub. The second group, application of benzalkonium chloride and polymeric biguanide hydrochloride, followed by alcohol rub. Third group, non-medicated pH neutral soap hand wash, then alcohol rub, and then finally direct application of alcohol rub. The samples were taken by pressing the distal fingertips to an agar plate before the hand preparation, after the hand preparation, and after alcohol rub application, and then 120 minutes later. Results show that 2 hours after surgery, the participants of the groups that performed the hand preparation had lower colony-forming units, meaning lower number of bacteria, than those that did not perform hand preparation. The number of colony-forming units was lower when alcohol rub was performed after application of the pH-neutral soap hand wash compared to direct alcohol rub. Conclusion was surgeons should wash their hands prior to applying the alcohol rub before starting their first surgery of the day, even when the hands appear clean. Introduction. Transient flora are susceptible to removal by routine hand washing because they only colonize a superficial layer of skin. Resident flora are deeper layers of skin and hair follicles, more resistant to removal, and are not likely to be associated with nosocomial infections. In contrast, transient flora are acquired by contact with other people, animals, and/or contaminated surfaces, and are the most common causes of surgical site infection. When the bacterial count in a surgical wound is at least 10 to the 5th or more colony-forming units per gram of tissue, the risk of surgical site infection increases significantly. The incidence of infection as a complication of small animal surgery can be as high as 18.1%. The ideal agent for pre-surgical hand preparation should adequately reduce microorganisms on intact skin, have broad spectrum activity, and have a residual effect. Between 4 to 80% of sterile gloves become perforated during surgery. There are currently 3 main types of antiseptic solutions. There is aqueous medicated scrub solutions, alcohol-based hand rubs, and alcohol-based hand rubs containing additional active ingredients. Alcohol rubs have been shown to be effective or even more effective than hand scrubs. Alcohol-based rubs were better tolerated than conventional hand scrubs with medicated soap, required reduced application time, and led to better compliance and tolerance among surgical staff in human hospitals. Alcohols also exhibit rapid broad spectrum activity against vegetative bacteria, virus, fungi. There's no residual activity. When it desiccates, regrowth of skin flora can occur in the humid environment under surgical gloves. So long-acting compounds such as chlorhexidine and gluconate have been added to alcohol rubs to help suppress bacteria growth under the gloves. One of the recommendations using alcohol rubs for surgical hand preparation is that an improved Hand rub should be applied to dry hands free of debris and gross organic material. So again, Group A was hand preparation with 4% chlorhexidine. Group B was application of benzalkonium and polymeric biguanide hydrochloride. C was non-medicated pH neutral soap. And then D was only the alcohol rub. Participants were required to have short nails, less than 1 millimeter, and free of artificial nails or nail products. Anybody with dermatitis, cuts, scrapes, or contaminated hands, fingernails, or arms were excluded. In regards to hand preparation protocols, to establish a baseline, all participants rinsed their hands and forearms up to their elbows under lukewarm running water for 30 seconds. They dried off completely using non-sterile paper towel. Then the three groups, A, B, and C, performed a hand prep by wetting and washing their hands and arms to their elbows using either the chlorhexidine, the benzalkonium, or the pH neutral soap for 30 seconds. Then they rinsed underwater for 30 seconds, then dried with a non-sterile paper towel. So that the total hand preparation procedure lasted 1 minute. I mean, right off the bat, I don't understand why they're using non-sterile paper towel and how they got past the approval for this paper, because that's insane. No one's using non-sterile paper towels. We're all using sterile paper towels. So this is bizarre to not even think of that and not to be criticized for this paper for that. That's a huge problem with this paper. Participants inside to the last group only did the alcohol-based rub with no hand preparation. It was accepted that all participants wash their hands at least once during the course of the day, like after going to the bathroom prior to entering the theater. Again, weird to have that not be standardized, that you can't have all the students for sure have washed their hands. They just sort of took it on good faith. The surgery was performed by the participants on the first day of surgery. So those are two big weaknesses to this paper right off the bat. Okay, discussion. The number of colony-forming units on the hands of participants that performed the hand preparation prior to applying alcohol rub was lower compared to that who performed no hand preparation. The recommendations for alcohol-based rub are made by several organizations, including the WHO, which is the World Health Organization, and the Association of Perioperative Registered Nurses. For surgical hand preparation, the WHO does not recommend a hand wash every time an alcohol rub is performed, but they do recommend that the hands of the surgeon or members of the surgical team should be cleaned only once upon entering the theater by washing hands with a gentle pH neutral non-medicated soap. Alcohol-based hand rubs should then be applied before and between procedures, but hands should only be re-washed if they are visibly soiled or they have contacted with biologically hazardous material. There is even some evidence that hand preparation prior to applying alcohol rub could negatively alter the effectiveness, especially if the hands are not dried sufficiently. So I was trained this. I was trained that you prep first, and that your first surgery with a hand prep, and then use alcohol rub, and subsequent surgeries can be just alcohol rub. In this study, the number of colony-forming units was lower after 1 minute of hand prep with chlorhexidine compared to the hand prep with pH-neutral soap, but no difference compared to a hand prep with the biguanide hand prep was found. Directly after an alcohol rub was performed, the participants of the group that washed hands with chlorhexidine had fewer colony-forming units than those of the group that performed no hand prep, but not in comparison with the other groups. Concerns have been raised about long-term use of chlorhexidine, with frequent reports of dry skin, eczema, dermatitis, also asthma, contact dermatitis, and immediate and or delayed hypersensitization. Veterinarian neutralizes quaternary ammonia compounds such as those used in the biguanine group hand scrub, and the combination of TWEN80 and L-alpha-lecithin is effective in neutralizing chlorhexidine. The most important result from this study is that 120 minutes after surgery ended, the groups that performed hand prep before alcohol had less bacteria than those that had no hand prep. More significant, the group that performed a hand prep with pH neutralized soap also outperformed the group where there was no hand preparation performed. So that's the end of the study. And then my other concern with the study too is there's no association between which colony forming units, like which bacteria was formed or grew rather, because some bacteria may not matter for the development of surgical site infections, and some might matter. But obviously, the goal of the paper was not to assess that. They just wanted to look at different hand preps. But that also been a good thing to know. Thanks for those supporting the channel. We'll see you again in the next one. Take care.